Times are changing, right? Things are getting kind of flexible and variable for everybody. And we just want to make sure that artists and self-employed people and Doherty Arts Center affiliates and community members across the city of Austin know what kinds of options they have available for them through foundation communities, and more broadly too through some of our community partners like the Central Texas Food Bank and others. So we're just going to give you a brief overview today of some of these programs and hope that we can get more into depth with you in the future if you do think that any of them are useful to you right now or moving forward. Right, like I mentioned, our programs are all listed here in the middle of this page. They are health coverage, our College Hub program, which, as I'll discuss, is also has transitioned a little bit during the COVID crisis to helping people with employment services like resume help and such. Our tax program just finished its kind of main push through July 15th, but is still helping people either file back taxes from previous years or if somebody has filed an extension, for instance, those services are still available to them. And then Chris will get into our financial wellness programs when he gets to his part of the presentation. And let's see here. So just very briefly, the financial wellness program Chris will talk about. Our College Hub is generally a program that helps traditional and non-traditional students get access to funding to go to college, either for the first time or if people want to go back to college to do things like recertify themselves or follow a new path in their careers or in their education. Our College Hub has been around to help them find money to do those things in the past. And since COVID has greatly changed people's educational paths, like many other trajectories on which they've been in their personal and professional and educational lives, our College Hub is also helping people navigate career options now, like I mentioned. They are helping students throughout the Austin Community College system and certain UT systems as well, and at St. Ed's, navigate the process of virtual learning, which is a big deal now, making sure that people have access to the technologies that they need, and helping folks develop study plans for those things or for those issues as well, because study plans are like necessary, especially when people are participating in virtual learning, and not often things that people have had training in. So in addition to those college-oriented tasks and responsibilities and needs that our community members have, just remember also that if people have say for instance like already been to the Workforce Solutions offices to go through work in Texas and maybe have already built a resume on that website, our College Hub can be another set of expert eyes with you to help you go over some of those materials and make sure that they are top notch while we're in this place where there's going to be lots of people applying for lots of jobs. So use our College Hub as a resource, not only for college application materials, but also for employment services too. And our tax help program, like I mentioned, I'm just going to replace that date there real quick. Because the tax deadline has passed, don't let that just deter anyone from reaching out to our tax staff if people have any other kind of tax needs also. So like I mentioned, some people have filed extensions for 2019. Some people have just have to file late, and that's okay too. Our tax staff are around pretty much throughout the year to make sure that they can be a resource to people who have any kind of tax question at all. For self-employed people, especially creative folks, if you have to pay into the system every year because the IRS doesn't, or because you don't have an employer who withholds any tax income from your paychecks, then our tax help team can also learn how to help you pay into the system so that you don't have a large tax bill at the end of the year. Right, all of our tax services are virtual right now. Our College Hub services, the employment services that they're also transitioning to, they're virtual right now. And we do have a very specific tax program set up so that if somebody does still need to file that tax return, we've got the system all kind of pre-structured for you so that it's pretty easy. And then our tax staff are there over the phone to help you out through that process if you need them. All right, and I'm going to spend most of my time today talking about our health coverage program because the development of COVID has caused some pretty significant changes in the healthcare market, not just in terms of services offered for COVID testing and COVID treatment, but also in terms of the programs that people have access to, like Medicaid, like the Children's Health Insurance Program, for people whose kids are on that program, or other children's health insurance programs also. And then especially for people who have experienced a life change that may have caused their former health insurance, like their employer insurance, to cease. There's all kinds of different options for people who are in that boat, including COBRA, which is the continuation of benefits policy that sometimes will kick in for employed people's health insurance or recently unemployed people's health insurance. And we're going to talk about those programs and the distinctions between them, just to make sure that everyone kind of knows what options they have and which ones can fit their lifestyles best now that people are considering things like crisis budgets during the pandemic, maybe new options for healthcare for kids, or loss of employment from employers, right? So all these things kind of fit together in a web that can seem sometimes somewhat daunting, but we're here as a resource throughout to make sure that Austin creatives and self-employed people and small business employees all have resources to help them feel equipped to move forward and to move forward with stability too. So we're going to talk about changes at the state and local levels in terms of healthcare coverage during the COVID-19 pandemic. We'll talk about Foundation Community's institutional response to the pandemic. So we'll just go over a little bit about how our programs are available in different ways to people. We'll talk about the Affordable Care Act or Marketplace or Obamacare. All of those are the same policy. So I just wrote it in there in case anybody has heard that policy called by different names. I tend to say ACA, but if some people like hear Obamacare and think like, oh, that's the only one that I know, then that's the same thing. But so there are some new opportunities for folks as well based on pieces that are built into that policy that allow people to enroll in plans in the middle of the year in some cases. And then there are also non-ACA coverage options available to folks too. And those include county programs, federally qualified health centers, COBRA, like I mentioned earlier. So we'll go through those also together. All right, and at the state and local level now then, if people have family members or children who had access to Medicaid before the pandemic hit, then the Texas Health and Human Services Commission did go ahead and extend Medicaid effective dates indefinitely. So people should not be getting Medicaid renewal notices in the mail. If they do, not to worry. Offices are not open right now, and there's no way for people to actually renew those Medicaid dates because right now they extend for the immediate future, essentially. Everybody will get notice as soon as renewals start again. But if somebody does get a letter in the mail that says that they need to renew their siblings' Medicaid or their parents or even their children's, then that was sent because it was an automated message, and there's no need to be concerned about it. Just know that Medicaid plan right now extends at least until October 23rd. And there will be more notices coming out in the future from the Medicaid office about those dates. But right now we know we have at least until October 23rd for those Medicaid policies. And the same is true for the Children's Health Insurance Program. And this is really important for people whose children have been on CHIP since before the pandemic. And we'll talk about different options for people if they want their children to get onto the Children's Health Insurance Program during the pandemic, because say incomes have changed, and if a child was on a parent's health insurance plan and that parent lost their plan, then that child can then actually switch over to CHIP and have access to equal services, but at much lower costs. But if somebody's children had CHIP before the pandemic, then their deadlines their renewal dates are also extended right now until October 23rd. Um, and then the Texas Health and Human Services Commission also started a COVID-19 mental health hotline, which actually has even two different features. There's one feature for regular community members and citizens who are feeling like they might just need somebody to talk to because of the stress of the pandemic. And there's also a whole separate line for caregivers also. So for nurses, doctors, people who are taking care of family members at home, if people have elderly parents or children with special needs, like these are like very stressful times for all of those groups of people. And so the Texas Health and Human Services Commission did start this free 24/7, so you can call them anytime, COVID-19 mental health hotline. And that number is here on the screen, but just in case anybody doesn't have access to the visual, it's 833-986-1919. And I'll go ahead and put that in the chat too after my part of the presentation is over. But I just want to put that out there because it has been a really great resource for lots of people, because it's just a quick and easy way to make a phone call. And you don't have to go through the process of setting up a telehealth appointment or something, like if you already have a mental health care provider. Okay, and at the local level, Central Texas community organizations have come out to really support their clients and their members during this difficult time. So as I mentioned earlier, marketplace plans are the same as Obamacare plans, are the same as ACA plans. So the 4 plans that are available to people in Central Texas, if there are self-employed people or small business employees or even unemployed people who are on these plans, all 4 of them in Central Texas agreed to cover COVID-19 testing and treatment for their members at no cost. If anybody is on one of those 4 plans, which include the Blue Cross Blue Shield HMO, Senderos Ideal Care, Superior Health's and Better Plan, and Oscar's plan, those are the 4 companies. Some of them do have end dates on that coverage, on that COVID-19 coverage eligibility period. But so it's always good to check in with your insurance company just across the board about anything, but especially about this because about the issue of coverage for COVID-19 testing. Because there will be some end dates on those. Like I know Oscars, I think, ended at the end of July, which doesn't mean that they won't extend it, but it's just a good thing to be able to call into your insurance plan if you do have one of those, because this change in the Central Texas healthcare market was huge for people who needed COVID testing or people who needed COVID treatment. And so the fact that the plans covered all of those was like really monumental and was so helpful in the Central Texas community. And let's see, there is a county program for healthcare called the Medical Access Program. Some people know it as MAP. There's another offshoot of that plan called MAP Basic. These are programs for people who live in Travis County who don't make enough money to qualify for a subsidy to help them purchase health insurance through the Affordable Care Act. And I'll get into that particular case here in the next 10 minutes or so. But Travis County's Integral Health Program, which is a health program for low-income folks, they started the medical access program so that people who didn't make enough money to qualify for health insurance, but who made too much money to qualify for Medicaid, would have access to a health program in Travis County. And what Central Health did then when COVID hit was they made an online medical access program portal so that people could actually fill out those applications online and not have to go into the office. So that was a big deal for folks who had low income and who needed some kind of care during this kind of traumatic and tumultuous time. So if people do right now not have health insurance and also maybe are, say, low income because those unemployment benefits just dropped at the end of July 25th, if some people are in that boat, definitely contact Central Health. And you can find their number by Googling Central Health MAP or Medical Access Program, and it's the first number that pops up. You can also use my contact info and reach out to me, and I can get you their info also. But the fact that they have this online portal is making it a lot easier for people who have new or steady low incomes to access healthcare in Travis County. If people live outside Travis County, there are different options available to them, like federally qualified health centers, which I'll get into in the next 15 or 20 minutes or so. And then lastly, our very local partners, like the Health Alliance for Austin Musicians, those organizations did lobby and advocate and really like do a really, really good job speaking for their members in order to get more funding from their partners so that they could expand programs that give their members access to very, very affordable health insurance. And so when people lost their jobs due to the COVID crisis, the Health Alliance for Austin Musicians really wonderfully came out and allocated or asked, got new funding and then allocated that funding to their members so that people would have the same benefits as other HAM members who were able to enroll earlier in the year in those public marketplace plans. So HAM does a really good job of making sure that people not only get on health insurance, but then can afford it throughout the year. And they extended that benefit to people who were newly on marketplace plans because they lost their employer coverage due to the pandemic. So those are just some examples of how local health organizations are also working with community members to help keep everyone stable. So I'm just gonna exit out real quick of my screen and see if we have any questions so far. Get to that chat. Okay, so webinar electronically, it looks like that's it so far. Okay, I'll go on. And yeah, everybody just, feel free to keep peppering in the chat if you would like to. All right. Now, Foundation Communities is a big organization. For folks who have never heard of us before, we've got 25 affordable housing sites around the Central Texas area, and a couple in Dallas too, one or two in Dallas. But what has happened during the COVID crisis is that those affordable housing sites have really become community hubs for people to access social resources, like the food bank or like different health programs. And then our health initiatives program has also started doing like online Zumba classes and such for free, which is just really fun. And it's a really way to like stay fit when you're at home. Some people can't go outside. It's so hot, it's a really good way for people to just kind of like spend some fun time together while we're all, physically distant in our homes. I'll also talk about changes that we've made to our Prosper programs, which is another word for the 4 financial programs that Chris and I are talking about today. So health coverage, our free tax help program, College Hub, and financial wellness, they're all called Prosper programs because in addition to those programs existing in our affordable housing sites for residents, they also traditionally have been available to community members in Austin in general and in Central Texas in our 2 Prosper centers. There's one on Airport Boulevard and there's one in South Austin on Stasny. They're both closed right now, of course. But I'll also talk about how those programs have changed, our Prosper programs, since the pandemic began. And then I'll talk about our health coverage program too, of course, which is what we're focusing on here. So this is a map of our affordable housing locations on the right-hand side of your screen or left. Now I'm not sure how they get flipped because of the Zoom, but in any case, the one that says studios, is for our adult residents who either live in 1-bedroom apartments or in efficiencies who don't have any children. And then our family apartments, we have many more of those. Those are for people who do qualify in terms of their income and their background histories for fixed rents in one of our, I think, 19 affordable housing locations in Central Texas for people who qualify for those affordable housing applications. So those are around town. And we do have wait lists for all of them right now. I don't think there are any that are just kind of like first come and get in. But if people are interested in pursuing our affordable housing programs, what you can do is go to our website, which is foundcom.org, click on the housing tab, and then you'll see in there a list that has each of these maps in it. And then it lists the property managers for each of those affordable housing sites. If you're a family member, if you live in a family with children, you can check out that family apartments list. If you're an adult or in an adult partnership and you don't have any children, you can check out that studios list. But the best thing to do is to find a spot, find an affordable housing location in Austin that works for you, and then contact that housing manager and just get to know them a little bit. See what their process is like, see what the community is like. For instance, we have some hand musicians who have apartments at Bluebonnet Studios at South Lamar and about Old Wharf. So that's a really good place for musicians. You know, there's people playing music often. There are other more quieter studios for people who don't necessarily want to live next to a drummer. Not that we all love drummers. They're all great. Okay, so we also have an emergency assistance program for our residents, and that program, donated to widely by the community, was able to help people continue paying their rent at our affordable housing locations due to even if they had lost income due to job loss. We're also advocating widely at our housing locations for census participation. So if there's anyone on this call who also has not yet filled out their census forms, that's a really important way for the local economy to get federal funding for things like voting polls, schools, food bank contributions, housing and urban development, so like other kinds of affordable housing. So I just gotta say it widely, everybody fill out your census forms. And we've been doing a really good job making sure that all of our community members in our affordable housing sites are filling out those forms too, just so that we get an accurate count of the people in Central Texas, and make sure we get that federal funding for social programs moving forward. Virtual summer programming, I mentioned a little bit in terms of our virtual Zumba classes, which are on here too. But our educational programs for the kids who live in our affordable housing sites have also gone virtual. So we are doing lots of online learning classes, different kinds of literacy programs for kids who have different reading levels and such. So it's like we're really kind of like maintaining those community support systems in education, in health, and in food security in our affordable housing sites, with all the kinds of digital technologies that we're bringing to our communities as well. Our volunteers are wonderful, and they've been making care calls to some of our kind of like individually homebound residents, so people who can't necessarily get out into the community. We've got like dozens of volunteers who are just calling and making sure that people have conversations with people outside of their immediate household. Just a way for people, again, to just like maintain in communication with their neighbors and with their community members, and just stay healthy during difficult times. So our staff also have mindfulness moments. Those are really wonderful times to just sort of like chill out for 45 seconds, to be quiet, focus on breathing, to do those centering activities that everybody needs to do, even while we're at home, on Zoom calls all day. And our health initiatives team is operating food pantries out of our affordable housing locations. So if people need to access food pantry contributions, then the website is the Central Texas Food Bank, and there is a little button on that website that says Find Food Now, and you can see which ones of our affordable housing sites are open then to go pick up groceries from, or you can just find the place that's closest to you also. I have noticed in just working with folks in the last 4 months or so, do be sure that you call the place that the food bank website says is open, because sometimes they will run out earlier in the day. So if you do know somebody who you're taking to go get food, or if you're going to go get food yourself, just make sure to like give them a ring before you go, and just make sure that they haven't just run out for the day. And we talked about virtual Zumba, which I just like want to start doing all of a sudden, but I won't. Okay, so our Prosper centers, like I mentioned, one on Airport Boulevard, one on Stasny, they're closed. So as soon as, it was almost as soon as South by was canceled. It was just a little bit after that. But we suspended all of our in-person services for our 4 Prosper programs, like very early on in March. Not long afterwards, just 3 days later, both our College Hub and our health coverage program were operating completely by phone. And then it took a little bit of time for us to get our tax website up and running. So all that in-person work that we did with people filling out tax returns and such, all of that went online too. And that happened on April 4th. And then, as Chris is going to talk about, our financial coaching program launched on April 13th for all virtual access too. Okay, we've kind of gone over most of these. Chris is going to do financial. Yeah, I'll just say it one more time. Virtual tax prep is available through September 25th. So anybody who hasn't had access to a tax preparer because of COVID or just because of general kind of like instability, be sure to use that program. And then College Hub for for employment support too. And the health coverage program, we do enroll about 5,000 households in the Central Texas area every year in marketplace plans. So as I mentioned, these are folks who don't have access to coverage through Medicare, through an employer, through a spouse's employer, or through a parent. And so we do those enrollments every year between November 1st and December 15th. And that's the open enrollment period for the marketplace. So the federal marketplace plans or the Affordable Care Act plans that then people get into for the following year. So for people who have coverage through the marketplace in 2020, most of them enrolled between November 1st and December 15th in 2019. So that's what we do for when people get covered, right? We go through their healthcare.gov application with them, make sure they fill it out right, answer all the complex questions accurately, and then go through the plans, the 56 plans that are available to people in Central Texas, and pick the one that's best for them. And all of our experts do like 32 hours of training in those plans and in the application to make sure that they know how to help people pick the one that's best for them. And then throughout the year, our health coverage program does work in advocacy. So we make sure that health insurance companies are following the policy and making sure that, for instance, like mental health care is covered as a primary care visit, not a secondary care visit, because those secondary care physicians can be a lot more expensive than primary care ones. And sometimes insurance companies will just mess those up. And so we make sure that if somebody sees that something's happening that's not on par with the policy, that we hold insurance companies accountable to those policies and to their clients. We also help people with appeals processes through the marketplace. If somebody gets a denial of a certain kind of enrollment, then we can actually work with them through that appeals process to make sure that they get access to all the benefits that they qualify for. And then the other main part of our year-round programming is helping people enroll in marketplace plans through special enrollment periods. And we help people use their plans also. Some folks are not familiar with searching through a provider directory or even establishing a primary care physician. So for people who are new to health insurance, we help them use their health insurance plans. And for people who have lost health insurance in the middle of the year for some reason, say they turned 26, say they lost their employer plan, say they got a divorce or got married. There's all kinds of reasons why a special enrollment period might open up for somebody. And we help people, again, fill out that marketplace application, make sure all of the information on it is accurate, and pick the plan that's best for them. And we do all of this with a staff of like 5 people. It's amazing. So these are our 5, and that's Ariana down there in like the very corner if you can't see her. So our staff is tiny, but they do a lot of good work throughout the year. And they're super stoked to help people learn about special enrollment periods. And also sometimes people come into the office after their special enrollment period has passed. And that window is generally about 60 days after a life event that qualifies them for it. And sometimes people just miss it, right? And if they do, then our staff, these 5 wonderful healthcare angels, help people figure out what they can do in the meantime, right? Access federally qualified health centers. Maybe they qualify for the medical access program. So these folks are really good at helping people navigate the health insurance market, no matter what their situation is. And then during the open enrollment period, because our staff is only 5 large, we get like hundreds of volunteers from the Central Texas community to come into our office, or this year all virtually, and learn about the policies and literally just take their free time to work with folks through healthcare insurance applications, which just seems like crazy to some folks. But then once you meet them, you really get a sense of like their passion for helping people and their real drive to help keep the community like safe and healthy. And you get it. And you're like, oh, this is why they love this work. All of our volunteers. It's a wonderful community. Okay, so I'm gonna stop for a second and go back and see if we have any questions in the chat. I don't think we do. No. Okay. then I will go on. Oh. All right, so what are marketplace plans and what is a special enrollment period? The federal marketplace was, it was a law, right? The Affordable Care Act was passed in 2010, and I'm gonna check on time, okay. And by 2013, the federal government had set up marketplaces to make sure that people could access this policy and get health insurance if they were either unemployed, self-employed, part-time employees, or small business employees. So those are the kind of main groups that this policy is meant for. Guaranteed issue, these are kind of some of the major provisions of the Affordable Care Act. Guaranteed issue is the standard that prevents health insurance companies for charging more or denying people if they have pre-existing conditions. So it means that the health insurance company is guaranteed to issue a plan with a standard price to people who have pre-existing conditions. Minimum standards are the certain characteristics of each marketplace plan the plan has to have in order to be available to folks on the public marketplace. So this is like, they have to cover pre-existing conditions for no cost. They have to cover mental health care. They have to give people access to emergency care anywhere in the United States at in-network costs if there's a life-threatening emergency that happens. So there's a list of 10, they're called essential health benefits that must be in every plan, and the Affordable Care Act guarantees those to anyone who signs up for it. Financial help for low-income folks, that's the subsidy that helps people purchase health insurance every month, and we'll get into that a little bit more in a second. And then the health insurance exchanges are just the websites that the Affordable Care Act sets up so that people can fill out their applications. In Texas, we don't have a state marketplace, so we use the federal one at healthcare.gov. And then this here is a list of the 10 essential health benefits that come along in every plan. And I'm going to skip them right now just for the sake of time. But like I said, I'll send these slides out to Sarah and she'll get them to folks after this presentation. And I'm just going to move some windows around here. Okay. Folks who are not eligible for marketplace plans is a very short list. It's a list that, lots of people are working on the sort of different shortcomings of the Affordable Care Act. But for now, people who are undocumented, people who are protected under the DREAM Act, people who are incarcerated, and people who are eligible for Medicare Part A. So that's folks who are generally over 65 and have been working in the United States for about 10 years. Those folks do not qualify for marketplace plans at all. For other folks, even if they have health insurance from their employer, technically they can purchase an ACA policy or a marketplace plan too during that open enrollment period. But if somebody has employer coverage that's affordable and adequate, then they don't qualify for a subsidy through the ACA to help make health insurance affordable. And so it doesn't really make sense to purchase that marketplace plan, but technically they could if they wanted to. So that list of those 4 ineligible groups, those are the only people who cannot buy a marketplace plan regardless of their income status. So folks who are eligible for financial assistance then, and that's the monthly subsidy that the IRS gives people to help them pay for health insurance, they don't have other offers of insurance, right? So either through employers, through Medicare, or through Medicaid. People do have to promise that they will file taxes each year to help them, in order to qualify for that financial assistance. And the reason for that is that the financial assistance comes from the IRS. And so the IRS, they give you an amount of money every month to help you pay for your health insurance plan that's based on an income estimate on your application. So the way that this algorithm works is for people who make more money, they get a smaller amount of assistance from the IRS to help them purchase health insurance. For people who make less money, they get a larger amount of assistance because health insurance is expensive, right? And so all of that sliding scale there is based on an income estimate on the application. So it can be a difficult process to do that estimate for people who are either part-time employees or self-employed, but that's what we're here to do, is to help people understand how the policy works and how they can achieve their maximum benefit, and also how they can update their plan throughout the year to make sure that they're not getting too much of a subsidy or too little. If somebody gets too much of a subsidy, part of the reason that they have to promise that they'll file their taxes at the end of the year is because the IRS will ask for that extra subsidy back, because the IRS at the end of the year knows how much income people make. So it compares that income that you make with the one that you estimated on your application. Now, it works the other way too, though. If people estimated on their application that they would make $40,000 in a household of one, then they would get a very small subsidy. But if they actually only made $30,000, then the IRS would actually pay them back at the end of the year the subsidy that they should have gotten throughout the course of it. So we're getting into kind of like minute financial or minute kind of like finance related issues here, but suffice to say that our staff are around year round to help people make those estimates on their applications and then change their applications if, say, they have a really lucrative few months and they know that they're going to make more money than they thought they were going to at the beginning of the year, then we can just help them adjust their application so they don't owe back the IRS a bunch of money when they do their taxes. So here at the bottom of this page is just the range through which people are eligible for IRS assistance to help them pay their monthly premiums. So if you're in a household of four, there is a minimum amount. People do have to make at least $25,750 in that household of four. And that's total household income for both working spouses or just one working spouse if there's just one. And then on the upper end of that, if that four-person household makes over $103,000, then they will not qualify for a subsidy to help them purchase health insurance. So they can still, of course, purchase health insurance, but they'll just pay the full premium each month. Okay, so we talked about that. Now, this is an important part of the Affordable Care Act. People oftentimes, especially when they're unemployed, like lots of people right now, when they fill out their marketplace application, they'll think, oh, I don't have any income right now, right? Like I have to put 0 on this application. If that happens, then people actually fall below the qualifying line of the amount that they would need to, the amount that they would need to make in order to qualify for a subsidy to help make health insurance affordable. And the reason that is because there has to be a 0 point on the application past which it wouldn't, the algorithm kind of like breaks down. So if somebody made $5,000 a year in a household of one and they were operating on the same sliding scale that everyone else does for health insurance, then the scale would actually end up giving them like $2,000 per month to help them purchase health insurance, which no health insurance plan costs that much. So there's this cutoff line for people who need to apply for those benefits. If you make under $12,490 in a household of one, then you don't qualify for a subsidy to help you purchase health insurance. Now, most states accepted a big chunk of money from the federal government to move Medicaid up to that qualifying line, but Texas politicians did not accept that funding, which just means that there's a big group of people who don't make enough money to qualify for health insurance subsidies to help make health insurance affordable, but they make too much money to qualify for Medicaid. So those folks are in a difficult space in Texas. Now, in Travis County, there's that medical access program that's available to them. In parts outside of Travis County, oftentimes we help people find federally qualified health centers near them in case they need preventive care or care for an illness or injury that's not an emergency room. Now, I just want to make sure that we're all clear on the forward-looking nature of the ACA application. So what that means is like when you're filling out your marketplace application, you consider the whole year that is to come, right? So when you fill out a marketplace application, whether it's in November of last year or whether it's yesterday, if you lost your health insurance at the end of July, say for instance, what you're supposed to do on the application is estimate your income for the year to come. So you know how much money you made in the first 7 months of 2019. If that wasn't enough to qualify you for health insurance, the application actually gives you the benefit of optimism. So if you think, oh, I can probably make another, on average, $1,500 per month for the rest of the year, then you are fully within your right to use that number on the application so that you can get up into that higher category and qualify for a health insurance subsidy to help make the monthly premiums affordable. If you're below that amount, then like I mentioned, you don't have a monthly premium subsidy attached to your premium, and you get those huge premium numbers instead, which can just be pretty daunting to people when they fill out the application somewhat inaccurately like that. Which is why we just recommend that everybody come into our office and have and let our health experts go through the application with you. Right. The income estimate on the marketplace application should be based on the year ahead rather than on the most recent months or the year behind you. And if people estimate that they're going to make over that qualifying line, right? So say you're in a household of 4 and on the marketplace application, you go, yeah, we're going to make $26,000 for sure in 2020. And then you end up not, there's no penalty for that. So you get that subsidy throughout the course of the year. And then even if you were, say, like even a couple $1,000s under that qualifying line, the IRS doesn't ask somebody who falls below the poverty line to pay back thousands of dollars of a subsidy on their tax forms. They don't do that, which is good, and that's part of the policy. And it's written into the law that people are able and allowed to make those optimistic decisions or those optimistic estimations when they're filling out that income portion of the application. And so, like I mentioned, there's no penalty for overestimating your income. Okay, so we talked about premium tax credits. Here's just a short description of like how that tax credit works. People will look at the $424 plan that it might cost a 34-year-old woman identifying person to pay for a health insurance plan. But then if the application is filled out accurately, then they'll get that $357 per month tax credit. And then they only pay the $67 per month for the monthly premium. So that's how that tax credit works. And it's applied directly from the IRS to the health insurance company every month. So people don't have to like worry about getting paid back by the IRS or something. They only pay that net premium subsidy after the tax credit is taken out. And then there is another form of financial assistance built into the ACA, and that's what's called cost sharing reductions. These 4 categories here on the screen, yellow is the lowest income level, purple is the middle income level, and you can see on that top line, household of 1, that's what HH stands for. The gray one is kind of like the 3rd highest income level, and then the light blue at the end is the highest income level, when people will still get subsidies, monthly subsidies to help them purchase their health insurance. And you see here those deductibles and copay numbers go way down for people who are in that initial income category. So the financial assistance that people get to help them pay for their health insurance plans is not just the monthly premium assistance. It's also these cost sharing reductions. So people who make less money have lower deductibles, lower out-of-pocket maximums, and lower prescription drug copays and doctor's visit copays than people who make more money. And that's, again, just all in the interest of people at any income level maintaining good health and financial stability also, because of course these things are intertwined. So this is just a list of like some kind of major medical care costs. Some people, especially like young creative people, or even folks who just like haven't really been involved in the healthcare system for a lot of their lives, they just kind of like write off the idea that they might ever need health insurance. And that's happening less in the last 10 years since the development of the ACA, which is a good thing. But regardless, some people just need to see these numbers before they'll actually be like, oh, I should have health insurance, even if it's like the cheapest plan that has the highest deductible, just so that, say you needed like an emergency open heart surgery, an $8,000 out-of-pocket maximum is going to save you $316,000 in medical debt if you did need open heart surgery. So this is a good slide just to kind of like keep some of those numbers in mind for medical costs. Okay, so this is Marie's costs for a major medical need, right? I'm going to skip this slide. These are just examples of a plan. So I feel like I've already done some of the kind of like big order finance work here. And I just want to show you the last page of the application on healthcare.gov, because there are 56 plans available to folks in Central Texas. And these used to line up, but they don't line up anymore. So the 56 plans that are available to folks in Central Texas are is a lot. And as I mentioned earlier, our staff are well versed in all of them and can help people make decisions about who their doctors are, which doctors are covered under which plans, what deductibles are available in each plans, what copays are available in each plans, and so forth. I see a couple of questions here that I'm going to go to. More information regarding the tax prep help. Yes, Miro, I will send you a link to the tax prep program. And like I mentioned, they're operating until September 25th. And you can use that link also that I sent in that chat, and you can follow the tax program through there. But I can also send you that link later on also. And then, yeah, you're welcome. And then let's see, Lisa's question is, if we would like to schedule a meeting with your office to fill out the application, what's that process like, and is there a cost? So right now, Liz, I'm sorry, the application process is all over the phone or via Zoom. So you don't have to come meet with one of our people in person. And everything, all of our financial programs are completely free also. So you don't have to, yeah, there's no cost to them for you or anyone else for that matter. Okay, special enrollment periods. Like I mentioned, some people don't have to enroll in health insurance plans during the open enrollment period because they don't have a need to. They have employer health insurance, or they have they have insurance for their spouse, or any number of things. But if somebody goes through any of these potential life changes here, if they are released from incarceration, if they move from one area to another, so from like one county in Texas to another county, if they gain immigration status, lawfully present immigration status, if they get married, all of these life changes may qualify people for a 60-day special enrollment period into a public health insurance plan. And there are some COVID-19 specifically triggered enrollment opportunities. And those are loss of coverage, right? Oftentimes loss of coverage due to having lost your job, or somebody having lost their job due to COVID, and then changes in income too. So on that chart that I showed you all earlier, if somebody is below the poverty line and they know that they won't be able to make enough money to qualify for a health insurance subsidy in the coming year, and then say they get another part-time job, or even take on full-time employment, that new income stability can sometimes qualify people for special enrollment into a marketplace plan in the middle of the year. It doesn't happen in every scenario, but our best advice is always make an appointment with one of our counselors, tell them about the last 6 months of your life, and they can help you see if you do qualify for any of those special enrollment periods, either based on loss of coverage or based on new income that puts somebody over that qualifying line in the middle of the year. COBRA is, as I mentioned earlier, the continuation of benefits plan that was a law passed, I think in the 90s, maybe in the late 80s, that allows people to continue on their health insurance policies after they've lost their jobs from their employers. But the trick is the employer often no longer covers a portion of that health insurance plan. So it's very expensive. And if anyone's ever tried to go on COBRA before, you've like seen that first bill and you're just like, whoa, $600 per month, that's wild. But so people do not have to opt for COBRA. If somebody does want to kind of like wait it out and see if that's a good option for them, COBRA is a retroactive coverage. So if you lost your job at the end of July and then you were on COBRA August and September, but say you didn't pay for August or September because you didn't know if you'd actually need it, if something happened during those 2 months, you could go back and retroactively pay your COBRA plan so that you would be covered those 2 months. If you applied for an ACA plan in the middle of the month, then that plan wouldn't start until the following one. So there might be a gap in coverage there when you could use COBRA as a sort of interim coverage. But only if you don't opt for the marketplace afterwards. Once you opt for COBRA, that's what you're in until the next enrollment period. And then CHIP and Medicaid also. These programs are important, especially because people have lost income in the COVID crisis. So if people had health insurance plans that their kids were on, if somebody even opts for COBRA themselves, if your income drops to a point where your child might be eligible for the Children's Health Insurance Program, then it's oftentimes good to go ahead and get them on it. This chart here on the left-hand side shows the maximum monthly income for CHIP eligibility for children who are under 19. So it's pretty substantial. Like it's low income. It's not high income or anything, but because people's incomes have dropped recently, it's possible that their children might qualify for CHIP. If they do, it's a wonderful alternative to having to pay hundreds of dollars per month to have a child on a parent's health insurance plan. And then, like I mentioned, if people don't qualify for marketplace insurance, say they miss that 60-day window or they just miss the enrollment period the year before, then there are county healthcare programs like MAP, and there are federally qualified health centers that offer sliding fee scales for folks who need access to coverage, some kind of like sliding fee coverage in the middle of the year. So these are not health insurance plans. They don't guarantee the same essential health benefits that marketplace plans do, but they are good opportunities for accessing preventive care in the meantime so that people can at least stay in good health until the next enrollment period comes around, when they can then get into one of those comprehensive health insurance plans. Here's our contact info. I put it in the chat too. I'll leave it there again. I'll also hook y'all all up with this flyer, and that just has it has basic information about COBRA, about the Children's Health Insurance Plan on it, and our contact info so you can make appointments. And we will stop here very briefly for questions before Chris goes on. And income for adult Medicaid. Liz, that is an excellent question. Medicaid standards in Texas are so limited that people generally have to have like almost no income, or they have to have some kind of intellectual or developmental or physical disability. And that's just because of the way that that's the way that the Texas Health and Human Services Commission follows the Medicaid policy at the federal level. You know, maybe one day Texas politicians will expand Medicaid up to that poverty line, but it just hasn't happened yet. And so Liz, if you do have different special needs that might qualify you for Medicaid, then what you can do is you can dial, it's 211, right? Yeah, so it's 211 for Texas Health and Human Services Commission. It's 311 for the city of Austin, or vice versa. But in any case, what you should do is contact the Medicaid office and fill out their application. And you can also do that at yourtexasbenefits.com. I feel like the website, and I'll put it in the chat, but the website is oftentimes the most efficient way to go through the Health and Human Services Commission, because when they ask you for things like your diagnosis or for income statements, you can just upload all of that to their website and avoid the hassle of faxing in or mailing in. So if you do have access to a computer, then yourtexasbenefits.com will be the best way to go about applying for Medicaid.
Thank you very much, Lynn. Yeah, so my name is Chris Cordova. I'm the Financial Wellness Coordinator with Foundation Communities. I went ahead and posted my contact information up. It looks like I have about 30 minutes or so. My presentation's probably a lot longer than that, but I'm going to go ahead and get through as much as I can, and so we can kind of work together on this. Now, I'm going to be talking about managing money during a pandemic. And in order to go ahead and be able to see a lot of your questions, I'm going to leave this kind of up right here. As Lynn mentioned, I work with the Financial Wellness Program. So we have about 3 different services that we can offer to the community. You don't have to be a Foundation Communities resident to access our financial coaching program. The service right now we're providing is via telephone or via Zoom. So if there's anything that you are kind of like a financial goal that you're trying to work through, if you're trying to improve your credit score, you can give us a call. And even if you're trying to find resources in the communities, our financial coaches, we do have a rather built out resource list for resources in the community. If you're looking for opportunities or organizations that can help you pay bills, we have a pretty strong list for that. A lot of the volunteers, just as Lynn had said, are volunteers within the community. A lot of our program volunteers are retired financial planners, financial bankers, retired bankers. We're current individuals that work in banking, that work in financial planning, that work in insurance, that just really have a skill set that they want to offer to the community. So they're available. We have appointments available starting at 9 in the morning, Monday to about Saturday. Our Monday through Friday appointments are usually about 9 to 5, and then our Saturday appointments are usually 9 in the morning to about noon. So we are accessible that way, and everything we offer is free. So that's our financial coaching program. Our second program is doing workshops such as this. We offer this to community organizations. So ordinarily my work would be going into each other nonprofits, other organizations we consider community partners, and doing these presentations live. Now we have pivoted to doing them to an online platform. And I'm actually in El Paso, Texas right now. I'm in my hometown. So I've been technically working out of El Paso for the past few months, but this is kind of, you know, some of the ways that the pandemic has given us opportunities to kind of relocate or also kind of just work in other parts of the state. But it's been a great opportunity for me to just be closer to family. So I've really enjoyed it over the past few months or so. The other aspect we have are our financial education classes. We're actually going to start a new round of those classes beginning on Thursday evening. They're going to take place. It's a 3-part class. We ordinarily give these in person, but we're delivering them on the Zoom platform. So they're taking place on Thursday evenings from 6 to 7, and that's going to be on the 6th, 13th, and 20th. These classes are free. You can register on the foundcom.org website, and if you go over to the financial wellness tab, you can go ahead and register for that. So those are kind of like the 3 aspects that we do offer. Another piece of the work that I do is I do some emergency assistance for the residents of foundation communities. So we review rent assistance requests and also electric assistance requests. And there are quite a number of community resources that are available right now to members of the community at large. And so we want to definitely let you know of those resources. So yeah, you can definitely make an appointment for that. And I am trying to pull up the chat box right now. One moment. I just want to be able to access any questions as they come in. But
Hey,
if
Chris,
Sarah, if you could help me.
Chris, I'll let you know when there's questions coming in.
Okay, and definitely my presentation definitely goes better when we do have some input from the participants. So if you do have a question that comes up and you want to take yourself off mute, that's fine. Or if you want to go ahead and deliver a question, I'm going to probably just ask some questions as we go along. If I can, I'll probably give you guys about 20 to 30 seconds to answer those. But the more kind of input that we get, the kind of quicker it goes by. So we're going to, we're talking about managing money during the pandemic. This is a new situation. This presentation, we've kind of tweaked it from recovering financially from a disaster, a lot like the disasters we saw in Houston during the flooding. But we were able to kind of tweak it to kind of see how the information we had already we can apply to surviving financially from this pandemic situation. So one thing we want to keep in mind is to develop an initial plan to recover financially from a disaster and watch out for scams. Definitely watch out for scams. There's a lot of, there's been a lot of opportunity to take advantage of individuals, especially as these stimulus checks were issued. Quite a number of individuals knew that people had more access to money. So there's a lot of different I guess, potential fraudulent businesses kind of popped up. So definitely we're going to give you some tips on how to keep an eye out for that. So we're going to go ahead and just kind of begin how disasters can affect your finances. So it can affect the cost of meeting your immediate needs, ongoing costs of items that you need, such as paying rent, paying your bills, access to food, and how kind of there were more roadblocks into just accessing these basic needs of life. There arises situations of possible identity theft, scams, access to financial resources, and penalties of missing payments. And also there was, we've seen a lot of individuals lose employment over the last 4 months. And it's been really difficult for them to kind of get back on their feet. This was a situation in March. We thought we should be back on our feet probably by summertime. And we've definitely have lived through this to the point where we know it wasn't such a quick resolution, and that we're still trying to make our way and survive through this difficult time. So steps to financial recovery, we're going to be talking about housing, income, and your job, bills and expenses, and protecting your money. So when it comes to housing, as we know, it hasn't been easy for us to continue making payments to the landlord. We have definitely seen there be a rise in community services, specifically through Travis County. We have encouraged a lot of our residents to apply through Travis County. It hasn't been easy for them to get through that process. That process is mainly going on online, but there's definitely like a 30 to 60 day turnaround through Travis County through the amount of applications that they've seen. So it hasn't been just there are funds within the community to help individuals. I'll say that, but I wouldn't say the process is very easy. So you definitely want to give yourself some opportunity and some time to go through that process. If you're unable to make a rent payment right away, definitely keep in contact with your property manager or your property staff, informing them that you need assistance paying rent. Keeping those lines of communication, you would be surprised how accessible landlords are right now. They want to stay on top of, they want to keep lines of communication open. They don't want individuals falling through the cracks. They want to make sure that they're able to help you or direct you to these community organizations that may be able to help you pay the rent. Now, set an appointment. You can set an appointment with Foundation Communities financial coaching program to find community organizations who can help with rent or utility payments. And you want to be able to locate paperwork community organizations have requested. I know in the types of paperwork we're requesting are pay stubs, bank deposits. We're looking for just kind of statements from your electric company, like what your last bill is, and also what your rent contract may look like, or possibly we're dealing a lot with rental situations. I haven't dealt a lot with dealing with mortgage lenders or anything like that. So primarily our wheelhouse has been the rental community. Now, when it comes to bills and expenses, definitely try to continue paying your bills, or at least try to make a small payment towards your bills that you do have due. You can, once again, contact us if you need assistance. Primarily, that is more if you're a resident. We have Austin Energy bill assistance where we participate in the +1 program. But if you do contact our financial coaching program, we do have the names of other organizations that you can contact that may be able to assist you with those energy bills. A lot like Lynn had mentioned, we have 211 as a resource that we use rather often. So you can follow up with 211. They do have resources within the community. It's going to be your option 1 to get referrals for community resources. Option 2 is usually your HHSC line. I used to work for 211 for about 6 years, so I'm very well versed in their process and how they operate. Now, you can definitely contact your financial institutions. Let them know that if if you owe them money in terms of like making payments or in credit card bills, you want to let them know the situation you're in. I know a lot of car loans are working with individuals, and I do know a lot of like student loans and credit card companies are working with individuals on a case-to-case basis to find out what bills you can pay and how they can work with you. You want to be able to contact your creditors and keep records of what you've spent money on. You definitely want to see where your money is going, especially if there's not a lot of money to go around right now. And I think the best advice is just definitely trying to plan ahead and just anticipating these bills in the future and access assistance programs. I know it's not comfortable or it's not easy to ask for help, but there are a lot of organizations with the food distribution right now, rent assistance, electric assistance that you can access within the community. Okay, when it comes to your income and job, that's probably the most important way of being able to kind of keep yourself afloat right now. Now, we're going to go ahead and talk about how I don't think it's any shock to anybody, but like just so many of our residents have been facing a lot of hardships, especially if they were undocumented. They didn't have access to applying for unemployment benefits or receiving any type of stimulus checks. So during this time, you want to make sure that you have communication with your employer. If you were furloughed from a job, you want to find out if you do have access of returning to that position. Contact your benefits providers. Keep track of your days lost, or just in case you have to file for unemployment or these sorts of things, you want to keep track of the days that you stopped working or that your work ended or when you were given that notification.
Hey, Chris.
Yes.
You have a question from Liz. What if you're self-employed?
If you're self-employed, I do know, just depending on your self-employment, that there were opportunities to apply for unemployment. I think a lot of it, I know for like a lot of Uber drivers and Lyft drivers have been able, because they were considered self-employed contractors with those companies. So I think there are avenues to still apply for unemployment. I know that the unemployment process has not been an easy process, but there are still opportunities. Now, if you are self-employed, I think it's going to really come down to proving what your income was. So it may come down to like showing what kind of deposits you are making during your self-employment. I know for us, when we're looking at assisting individuals with rent, we're trying to find out what that difference in income was before COVID and what it is now. And we're asking people different ways to just show what deposits they were using in their bank, or just if they had any like proof of income. And if it's a last case scenario, we just kind of take people's statements that are like attestations, and we're going by that. But primarily the assistance we're offering is for residents of foundation communities, but our financial coaches can get you referrals to other outside organizations. If you do have like an assistive animal or a service animal, make sure that, or repair for assistive technology, making sure that you just are tending to that. Contact your disability or insurance provider. Explore public benefits such as SNAP or unemployment if that's something that you think you would be eligible for. And you can also contact schools and financial aid offices. Right now, I know that financial aid offices were kind of extending more benefits for students, and as far as like owing money, there are some extensions you can file for, or where they're not going to charge you interest right now, or you can put your payments off for now. Now, you want to also kind of think about protecting the money that you currently have or that you're currently earning. So get and review your credit reports. It's just a good idea. I know we always encourage individuals to get to check your credit report at least quarterly. Contact your financial institutions just letting them know the specific situation you may be in, and find a safe place for financial information. Cash on hand, just I wouldn't advise you to keep a lot of cash in your home, but that's more so if we were like involved in like a flooding situation. But where if banks were not in operation right now, it would be helpful to be able to pay for things in cash, and just kind of keep track of other valuables during this time. But you definitely want to keep on top of like where your social security card is, where your ID is, specific rent documents, just if you need to apply for specific benefits, you're able to have quick access to those items. Now, be proactive if issues occur. Also, first contact the company directly. Then if needed, contact the regulatory agency. This is more so if you're looking at your credit report and you see things that aren't correct, if you see that there may be some charges that you did not take out. So yeah, you definitely want to contact your company first, let them know directly. If there is a credit bureau or agency that has reported this item that doesn't look correct, you want to be able to contact them and try to get that corrected. Consider filing a complaint with the state regulators or state attorney general's office if you see any fraudulent claims being there on your credit report. Now, if these issues do arrive, one of our financial coaches can help you through these steps of making a report. And so these are going to just be some quick ideas of how to avoid scams. Get and check the references of any businesses that are contacting you, or I've noticed that a lot of people are reporting that they're being contacted either by phone or by email. I received one from my bank yesterday. It did not look correct. It looked like it was kind of a phishing scam, and they used kind of Bank of America's logos and everything. I reported it to Bank of America right away. It kind of helped me with peace of mind of doing that. But also, another point that's provided is ask to see state or local permits. Don't pay if anybody's offering you any type of service, such as like a credit repair or credit service. Don't pay in full upfront. Get and keep all receipts, and don't pay for services that should be free. Like I'd mentioned, these credit report agencies or services or businesses, that is something nonprofits such as ourselves can help you with for free. So you don't want to necessarily have to pay for those types of services. And just some more tips on scams: research organizations you're not familiar with, protect your information, and monitor your credit reports. Read scam alerts and report scams. One thing I do is if something seems like, if telephone numbers seem a little odd that I'm receiving, if emails seem a little odd, I am Googling them and I'm putting scam right next to that, and I'm seeing kind of what comes back. And you would be surprised how many other people have gone through a bad situation with these companies and people are not afraid to put their horror stories all out there. So definitely do your research. If something does not sound right, be proactive about it and try to try to just kind of problem solve from there. Not everyone who offers help is a legitimate source of help. Be on the lookout. Protect yourself by being cautious. Be selective when you hire individuals. And so now, we've been kind of dealing with this pandemic for about the past 4 months. So some of this information is probably things you have already done and you've already approached. So definitely adjust your financial picture after the disaster takes place. Take time to grieve and get used to the new reality that you're finding yourself in. I think it's taking all of us and down a road. And I think this whole pandemic situation is something we've all been dealing with a little by little, and it's been difficult for everyone. So it's okay to grieve. It's okay to be not feeling great about the situation that we're in. and definitely ask for help. I would say reach out to healthcare professionals, mental health professionals, organizations such as us that can try to help you kind of put your finances back together. It's difficult. I would say this is not an easy situation that we have found ourselves in. So I definitely encourage everybody to reach out to help, because this is the time to do it. Review and adjust your spending plans and your savings plans. Contact your lenders, contact your financial institutions, get and review your credit reports, and set new goals and make plans to reach them. This is one area we can definitely assist you with, and make those goals realistic. This isn't, I think a lot of us took a shift into being on these financial goals that we had set for ourselves. They were short term or maybe even long term, and we've had to refocus and readjust to a survival mode, which is really difficult. I would say the majority of the people we work with have had to just kind of pivot to some type of survival mode and really just rely on unemployment benefits, community resources, and they're in a new situation where they're having to ask for help, but they're also having to face the responsibilities and their obligations of paying rent and paying bills. Now remember, this is just a reiteration of what we had mentioned before. Develop an initial plan to recover financially from a disaster and watch out for scams. Real briefly, when money is short, we're just going to have to talk about this. We're going to go ahead and just go through this real quickly. Prioritize which bills to pay first when money is short. How does it happen? Even with careful planning, money can run short. So what can you do? You can try to increase your income. If that's not an accessible outlet for your or option, you can decrease your expenses. You can contact your creditors. You can reach out for help. And I think ultimately is prioritizing what to pay first. Ultimately, prioritizing based on what might happen, make choices about which bills to pay in full, pay partially, or pay late. Pay attention to consequences that prevent you from you earning an income, jeopardizing your shelter, impact health or ability to live independently, or could result in loss of your assets. So these are all things to take into consideration. I think right now, since we are in a shelter-in-place type situation, we definitely want to take care of our shelter and our housing as our first priority, and find out what can be done in order for us to stay there. And now I'm really excited that there has been the extension of the evictions. I think that's till September 30th for Travis County. So that's definitely keeping more people housed for the time being, even if you had been late on your rent for a few months. Now we're going to go ahead and skip that. So just prioritize which bills to pay first and when money's short. At this time, we're probably only have about 4 minutes left, but we went through a lot of information over the last hour and a half. So this is just kind of take some time of what type of action you can take, what you can do, how will you do it? Will I share my plans with anyone else? If so, who? And that's just making yourself more accountable of just some of the steps you'd like to take. Now, I know we went through a lot of information this evening, but I definitely encourage all of you to reach out to Foundation Communities. Our contact number is 737-717-4000. Reach out. You can speak to a financial coach. We can provide community resources, and our appointments are available Monday through Saturday. They're open to anyone in the public. They are free, and right now we are on the phone and Zoom platform only.